I decided to do my client health education teaching on the different cultural awareness that nurses have to know while working in the hospital. So when it comes to nursing, being culturally sensitive and educated is very important. This means being able to advocate for all patients of different races, cultures, religions. This also means respecting their choices when it comes to spiritual needs, end-of-life care, different food preferences, and also just knowing the different kinds of common diseases found in these people. So sometimes in nursing, you may come across a patient that doesn't speak the same language as you do, whether it be Spanish, Greek, Italian. I've seen many different languages while working in the hospital. So when you use an interpreter, there's a couple different options when you're in the hospital, like using a two-way phone to speak with someone, or you can also use a video interpreter where you use a tablet and you communicate that way. Or we also have in-house interpreters that can be called into the patient's room to use when they're available. Some things you should know while using an interpreter is to speak directly to the patient. A lot of times you want to speak directly to the interpreter because they're there and they're the one translating, but it's really important to speak to the patient and then wait for the translator to step in. It's also important to use concise sentences. You don't want it to be too lengthy because then it can get lost in translation. So I just wanted to show a video about what not to do.
Okay, it's going. Hi, how are you? Mrs. Smith? I'm Dr. Morrison. Nice to meet you. How are you doing?
Oh, she doesn't speak English. Do you mind if I translate?
Sure, are you related or?
I'm her brother.
Oh, okay. And have you translated like this
Oh,
before?
I've done this before.
You don't want to use a relative while
We can get a
interpreting.
translator, but.
Yes, I can do it. Don't worry.
Oh, okay. All right. So, can you tell her, ask her why she came in?
You don't want to speak directly to the translator, and especially not a family member.
She's having some belly pain.
Okay. When did it start? Can you ask her when it started?
2 weeks ago.
Oh, just 2 weeks ago? Okay.
Mas é que tem que conversar com você primeiro, ok? Deixa ele falar e depois a gente vai ver o que a gente pode dar pra você. Sorry.
Oh no. Can you ask her if she has any like nausea, vomiting, hematemesis, metopesia, fevers, or any other
The
symptoms?
doctor is
or did she
using
eat
words
anything
that the
funny
patient
last
wouldn't
night,
even
or,
understand.
You know, has she had this before?
Ele quer saber se você já tem alguma outra doença.
Que outra doença? Eu tô de barriga, não consigo mais.
Diz não.
Eu não sei mais o que tá acontecendo.
Não.
No. Okay. Does she have any other medical problems that she's had before?
Você tem alguma outra doença? Pressão alta? Você tem alguma outra coisa?
Lembra aquela vez que ela foi no médico e tinha a pressão tava alta?
Eu lembro disso, mas você acha que ele quer saber acerca disso?
Sim, ele me deu um remédio, mas eu parei de tomar e depois mamãe disse que eu tinha asma quando eu era pequena.
Ah, mas isso foi por muito tempo atrás. Eu acho que você não é. Você acha que você
Eu
tem?
não sei, mas não sei se vai ter de novo. Mamãe disse que sempre volta.
É que ela quer que você tenha uma pressão alta.
Ah, ele deu um remédio, mas
The family member is obviously asking more than what the doctor
She
asked.
said she didn't have any other medical problems? Okay.
Hey, Dr. Morrison, I think I found some free air under the diaphragm on her x-ray.
Oh, on her x-ray?
Yeah.
Okay, hold on.
Hey, wait, what's going on?
That's not what you want to do. So now that we learned some more about interpreters and how they should be used and how they shouldn't be used, I'd like to move on to different cultures that we see in the nursing in the hospital. First, let's talk about the African Americans. When it comes to communication, they may use head nodding, but it may not always mean that they're in agreement. It's also important to know that sometimes they find personal questions really intrusive and you have to be mindful when speaking to them. Some common health risks that are found among the African American race are sickle cell anemia, where the cells in your body, they become moon-like shaped, and it can be very painful, which is known as a sickle cell crisis. Also hypertension, known as high blood pressure, heart disease, diabetes, cancer, and they can also be lactose intolerant. The next culture is Asian Americans. When communicating with them, it's important to know that silence is valued. This is seen in many different cultures, but it's important to know that just because someone's silent in a conversation isn't necessarily a bad thing. Also, eye contact may be considered rude in some times. So if you notice that the patient is looking away or not making eye contact, it could mean something different than how we would normally perceive it to mean. Some health risks associated with this culture are hypertension, which is high blood pressure, heart disease, lactose intolerance, and thalassemia, which is an inherited disorder of the red blood cells where there is not enough made, which red blood cells carry oxygen to our peripheral limbs, and it's the way that we breathe, so with not enough red blood cells, it would be very challenging to breathe. Next, we have Hispanic and Latino Americas. For the way that they communicate, it's important to know that they use verbal expression. They can be loud, they may use their arms a lot when they're communicating as gestures, and they value their privacy, just like the African Americans. So it's important to know when working as a nurse, we have to ask very intrusive questions about things people may seem as uncomfortable. So it's just important to be sensitive when speaking about them. Some health risks associated with them are hypertension, heart disease, diabetes, and they're at increased risk for parasites depending on where they're living. And then we move on to white Americans. For communication, eye contact is a sign of respect. That's why we have always learned growing up that when you're having a conversation, you have to make eye contact, where other cultures may see this as a sign of being rude. Also, silence can be respectful or disrespectful. So the main takeaway from this is you have to be sensitive to all people. You have to be able to read body language and just assess the scene as you're moving forward in the conversation. Health risks associated with this group of people would be heart disease, cancer, diabetes, hypertension, and thalassemia. Now I'd like to move on to religions and their dietary preferences. We'll start with Buddhism. So normally for them, alcohol is prohibited. Many are lacto-ovo vegetarians, which means they don't eat meat, but they will drink milk and also eat eggs. And then some eat fish and some avoid only beef, so it really depends on the culture in their home. Next we can move on to Islam, where pork and birds of prey, alcohol, any meat that is not ritually slaughtered are prohibited. And then during the months of Ramadan, the fasting occurs during the daytime. For Jehovah's Witnesses, any foods where the blood is added is prohibited. So that means that they can eat meat that has been drained, but they wouldn't eat like a very rare steak that still contains some blood in it. As far as Judaism, we're going to talk about the Orthodox Jews. They have their kosher laws, which means that they can eat meats and animals that eat meat. They also can eat cloven-hoofed animals, but the combination of milk and meat is strictly prohibited. They must have separate plates for this. I remember I was having a conversation with your grandmother, and she told me about a time where she was over at your grandfather's house and she accidentally put some kind of dairy product and meat product on the same plate, and your grandmother threw the plate on the ground and threw it in the trash because she said the plate was contaminated. And then also they celebrate Yom Kippur, which is a 24-hour fasting period, but pregnant women and children can be excluded from this fasting. Next we have Hinduism, where many of them are vegetarians. They also have their fasting rituals. that they do, but children and pregnant women, they're not allowed to fast during these times for safety and health reasons. Next, I'd like to talk about end-of-life care when it comes to religion, which is a very sensitive topic. Everyone has the different ways that they believe afterlife happens and the different ways they want their family to be treated during these times. As far as Buddhisms go, they normally have a shrine that they set up that's for Buddha. They allow time for meditation after the patient has passed or is in transition. They refuse any kinds of opioids, which would be heroin and morphine. They refuse these medications during this time. They want them to stay pure. And sometimes they'll have a monk come to recite prayers for around an hour after the body has passed. And they strongly believe in organ donation, which I found to be pretty interesting. Next, we can move on to Islam. They believe that only cousins or uncles who are male should be contacted after the parent passes. They also have to face Mecca when the person is passing, which would be southwest. They elevate the head of the person, and they believe that stopping any kind of medical treatment would be against Allah. So if the person was on life support, they would continue the life support until they passed. They also think that the same sex should handle the body after passing, and any person who is not Muslim needs to wear gloves while handling the body. And an interesting thing that I came across was sometimes after a body passed, they may slap or hit the body out of emotion, and this is a very normal thing that they do. Also, I'd like to talk about Jehovah's Witnesses. I know a lot of the times we see patients who come in and they refuse any type of blood products, even if it means saving their lives. It's something that is really against their religion, and something as a nurse, we just have to be able to value it and not judge them because they're able to have their choices. We are able to explain to them, you know, the medical and scientific reasons behind it, but at the end of the day, it's their choice. Jehovah's Witnesses also believe that the soul cannot live on after death. A lot of other cultures believe that this does occur, but in this religion, that's not something they believe in. Next, we have Judaism. They also believe that the body should remain on life support until that they are passed, and that no dying person should be alone during the time of passing. And they also don't believe in autopsies after death or cremation. And lastly, we have Hinduism. A lot of times they'll tie a thread around the neck or the wrist of the person who's passing. They will put basil on their tongue. And then they also believe that these sacred strings that they tied on the wrist or the neck, that they will not be removed. And they also do not believe in washing the body after the person is passed. So a lot of times in nursing, you know, we have our own beliefs, we have our own values, and there can be different stereotypes that come into play. So I just wanted to show a video about stereotypes and basically what not to do.
There.
Hi.
Nice day, huh?
Yeah, finally, right?
Where are you from? Your English is perfect.
San Diego. We speak English there.
Oh, where are you from?
Well, I was born in Orange County, but I never actually lived there.
I mean before that.
Before I was born.
Yeah, like, well, where are your people from?
Well, my great-grandma was from Seoul.
Korean. I knew it. I was like, she's either Japanese or Korean. But I was leaning more towards Korean.
Amazing.
I'm Shasil. There's a really good teriyaki barbecue place near my apartment. So I actually really like kimchi.
Cool. What about you? Where are you from?
San Francisco.
But where are you from?
No, I'm just American.
Really? You're Native American?
No, just regular American.
Really? Where? Must be a Korean thing.
So that video just hit on some stereotypes of things obviously not to do. A lot of times in the hospital, you know, when we're taking care of different patients, we have to be really sensitive about the different things we say or the way that we treat them. Overall, it's just really important to be culturally aware, and that's something that we learn early on in nursing school, and it's something that will help you throughout your whole entire career. So now, Jared, I just want to ask you some questions after watching this presentation. They're multiple choice questions. So, when speaking with a patient who speaks a different language, which is the best practice? A, speak loudly and slowly. B, arrange for an interpreter. C, speak to the patient and family together. Or D, stand close to the patient and speak loudly.
I'm going to go with B, arrange for an interpreter.
That is correct. Question number 2. Which meal is appropriate for the patient of Orthodox Judaism faith? We have A, pork, rice, vegetables, mixed fruit, and milk. B, crab salad on toast, potato salad, and milk. C, sweet and sour chicken with rice and vegetables, mixed fruit, and juice. Or D, noodles and cream sauce with shrimp and vegetables, salad, mixed fruit, and iced tea.
I'm going to go with D.
I'm sorry, but that is incorrect.
Oh, man.
So the answer is not D, because this involves shrimp and a cream sauce, and they only eat certain types of sea creatures. But C actually turns out to be the right answer, because it's the sweet and sour chicken with the rice, the vegetables, mixed fruit, and juice. A and B are not correct because they offer the pork and the crab, which are not allowed, as well as the milk combination. Good try, though.
Thank you.
Okay, number 3. We have which patients have a high risk of obesity and diabetes? And this is select multiple. We have a lot of tests like these on our exams in school and in nursing lectures, so I figured I'd put this one in there. A is Latino American man. B is Native American man. C is Asian American woman. D is Hispanic American man. And E is African American woman.
I'm going to go with A, D, and E.
Close. A, B, D, and E. The only one who's not at the highest of risk is the Asian American woman. It has a lot to do with the different things that they eat. They tend to eat very natural and whole foods. Next question. What religion does not believe in blood transfusions? A is Islam, B, Judaism, C is Hinduism, and D is Jehovah's Witness.
I'm going to go with B.
B, Judaism, no. The answer would be D, Jehovah's Witness. As I said before, they don't allow to eat any kind of meat that has blood. They also don't receive any medical treatment that has blood involved, which I said can be a very difficult time when you're a nurse or it's someone that you love, because a lot of times blood transfusions can save lives, but it's important to be able to respect their decisions. Number 5. When you are using an interpreter to speak directly, when using an interpreter, you should speak directly to them instead of the patient. True or false?
False. Oh.
And the 5th and final question I have for you is, when using an interpreter, you should speak directly to them, the interpreter, instead of the patient. We have true or false.
I'm going to go with false.
False is correct. When using an interpreter, you should speak directly to the patient and then have the interpreter translate. This is a sign of respect, speaking directly to the patient, and it's the best way to keep them involved in their care, even when they don't understand what you're saying.
Have you ever had to do that before in the hospital?
Actually, yeah, I've had multiple patients that speak Spanish that I've taken care of. A lot of the times we use the two-way phones. They're these blue phones that have two phones connected. You pick up one and you call the operator. You select what language you want to speak, and then you give the patient the other phone. So then you're on a two-way call with the interpreter speaking in the middle of it. They're able to translate back and forth, and it's an easy way to communicate with the patient, and it doesn't take as much time as trying to find an interpreter, because a lot of the times we have these blue phones in the patient's rooms. Some other times I have used the video calls, which is where you use a tablet. There's normally only one of these on the floor, but they're a great way to be able to have that interaction, because you can see the interpreter on the tablet, and then the patient can see the interpreter as well.
Neat. I didn't know that.
Yeah. Any other questions?
How often do you interact with people that have a lot of these religious, like the blood transfusion kind of a thing? It seems like a big deal. Have you ever come across anything like that since you've been there yet, or not? Not yet.
Since working in the hospital, I haven't come across any Jehovah's Witnesses who are refusing blood, but I have come across a patient of Islamic faith who was in transition of passing. Their family was there at the bedside, and I was there when the patient passed with the family. And after passing, I was able to help the family in their religious washing of the body. We had to use warm washcloths and wipe the body using a different washcloth for each limb. Then the grandfather had to pray for the patient, and it was just really neat to be able to see the process that they went through in honoring their loved one after they had passed.
Yeah, that seems really interesting.
Any other questions?
Does the hospital deal with, so say you have dietary restrictions based on your religion, do you guys, work with your cafeteria and, make sure that they get, because I know some, if you have surgery, it's very specific on what you can eat. What if that doesn't fall into your religious category? Do you work with that?
That's a great question. I think that the hospital should do more when it comes to that, because the dietary restrictions can be so severe. I know that the patients are able to call down and speak with the workers and request what they would like on their tray, but I do believe that there should be more options available for their religious preferences. I know a lot of the times when people are on different heart diets, they can't have as much sodium, or maybe they can only, if they're diabetic, they can't have many carbs, so meats may be more of their option. Another thing I'd like to mention is that a patient in the hospital, their family is able to bring them food that they can eat. So if they like a specific home-cooked meal, their families can bring it in, and we have a fridge dedicated to our patients, and we can put the foods in the fridge and label them for the patient to be eaten and heated up whenever they need it.
Very cool.
So I hope that you learned a lot about culture and what we have to experience in the hospital. It's different every day, but it's just something to be aware about. And I also think it's important for not only nurses and healthcare providers, but just people out in the street. You never know what someone's going through, and you never know their preferences when it comes to life and different types of eating and end-of-life care. So the main point is to have an open mind.
Well, as a person out in the street, I can say I have learned a lot from this experience here today.
I'm glad. Thank you.